So modern methods of treating the disease of the pyramids. Hello, my name is Kola Saverina Viktorovna. I work in Russia, treating the disease of the pyramids. A very interesting topic, modern treatment methods. Guys, I often encounter, dear men, that most urologists actually have a poor understanding of the disease of the pyramids. If you go to a doctor, please ask them how they themselves understand this disease. If they can't clearly break it down into distinct parts for you, you can just turn around and leave right away. Because the modern treatment of pyramid disease depends on this. It depends specifically on the stage of the disease. There are different stages, and at different stages, the treatment is completely different. If at the first stage we use medications and physiotherapy, then at the second stage we use only surgery, nothing else. Everything else is just an addition. We might use one excellent medication which I'll talk about later, but in reality it won't have any effect. No folk remedies will save you. The only thing you can try to ease your condition is hirudotherapy. With that, I have seen some distant effects. No herbs, rubs, compresses or ointments. They won't work. The course of the disease is very severe and aggressive. It has a very serious progression. The disease develops rapidly, suddenly, like an avalanche. In a year and a half, bone forms. In places where it shouldn't be, we can't really grasp the concept, can we? In places where it gets in the way, where it will always interfere with your sex life. So, see a doctor and don't get unnecessary ideas in your head. I'll be glad to see you at my online consultation. By the way, the sooner you come to an online consultation, at least we can determine the disease, whether it's Peyronie's or, God forbid, penile cancer, which is also quite common. Don't mess around with this. A healthy man's penis never hurts. Please remember that. Pain in the shaft of the penis. That is always a pathology. No curvature, but there is pain. It was a pleasure. All the best.